starting with so my acute compartment syndrome was a result of a drug overdose.
Mm.
Um, the what actually happened to get me into the like physical position of how I was laying, I do not remember. All I can go is based off of like the medical report and the police investigation that they quote unquote did, because there was really no police investigation.
Mm.
Um, it was from fentanyl, and I remember doing the fentanyl, and it was from a relapse. I'd been on and off in recovery, and it was from a relapse, and I was in St. Louis, Missouri, which is where I'm from, and that's where I was found. The last thing I remember was it was about 10 p.m. I was not found until about 6 a.m. and there was someone that found me. They called the police. They then left me there, which is fine because they saved my life in the end of it all. But whenever they whenever the EMTs were there, they gave me the Narcan because they thought, oh, she just overdosed, which was true. But they kept telling me, get on the stretcher. And I was like, I can't move. And of course, they were treating me as they would someone who had just overdosed. And so they just kind of, it's not my first time that I've been in the setting of a hospital as being someone on drugs. And so they're like, well, we have to take you to the hospital to monitor you because we just gave you the Narcan, but you can't fall back into an overdose. And the whole time I'm in the ambulance, I remember I was screaming, like screaming how bad my legs hurt. And they just kind of were like, okay, you know, they at first they told me I had a seizure because the tip of my tongue had been not really bit off, but like kind of bit off. So they were like, you just had a seizure, your body's really tense. That's all it is. So and I don't remember anything. So I'm like, okay, maybe I had a seizure. I don't have a history of seizures, but at this point I'm like, whatever. So I get to the hospital. Again, they're still monitoring me for the overdose, making sure I don't fall back into an overdose. Um, I remember being extremely, extremely thirsty. I kept begging for water. They said, no, we can't give you water. And they had me hooked up to a catheter. And once they pulled up the bag of my urine, it was almost a cola color.
Mm.
And and in my head, while this is all happening, I thought it was happening really, really quickly. But after I'm reading my medical records, it had been about 5 hours that had passed that I'd been laying in the emergency room. And so the doctor comes in and she's like, are your legs bothering you? And I'm like, well, yeah, I've been telling you all this for some hours now. And
Sure.
she's like, okay, well, I'm going to go get a surgeon. The surgeon comes in. I know that they did the test where they, poke to check your pressure.
Sure.
I don't remember it happening. I just know from my medical records that it was done.
Right.
Um, the surgeon comes in and he tells me what's happening, and that essentially he has to amputate my right leg. And at this point, I'm in so much pain that I'm like, do whatever you need to do. At
Mm.
this point, I had already gone septic. The reason my urine was the color it was is because I had already gone into 100% renal failure.
Good,
And
good.
as well as, and I think that's kind of what connected the two. Um, and thankfully, I was at a hospital that I was at WashU in St. Louis, which is a pretty good hospital in the country. So thankfully, I was there because I can't say I would have gotten anywhere else
Right,
in the
okay.
area. And so they took me into surgery. They explained what happened. I still didn't fully understand it because from what I know from a drug overdose is you have, especially with fentanyl, you have about 12 minutes and you lose oxygen to your brain and you're dead.
Uh,
And so kind of how they explained it to me was that I didn't do enough of the drug to kill me, but once the toxins, I guess everyone has toxins in their fascia,
mm.
once that was released into the bloodstream mixed with the fentanyl, it knocked me out, caused me to become septic, and that's kind of how I was able to stay alive.
Uh,
Um, I was in critical condition for 17 days in ICU.
Uh,
They didn't know if I was going to live. I had a collapsed lung also at the time and the liver failure. Um, and so that's kind of what led me to have the compartment syndrome. And it's coming up on 2 years in about 9 days that it happened to me. Yeah. So then I was in the hospital for about 45 days. After they told me, and it happened to both of my legs. My left leg had a pressure of 33, and my right leg had a pressure of 68. I want to say it was 68. So my left leg's always kind of been able to, it gets numb and, has whatever, but it works for the most part. I did have to get skin grafts on both of them. In my right leg, well, they told me I would never walk again while I was in the hospital. I was sent out of the hospital with a wheelchair. Um, and I still to this day do not have range of motion in my right foot, which is the foot that I would drive with. So I still don't have range of motion in that. It is getting stronger, but sorry. It is getting stronger as the time goes on, but an issue that I run into now is I am unable to find any doctors that really know anything at all about it.
really, yeah, sure.
Yeah.
Yeah, yeah, that's what I've come across with talking to the people is that they end up coming to doctors and they know more than their doctors or GPs wherever.
Exactly what's happening. Yes. Like I went to the doctor. So I'm from St. Louis, Missouri. I just moved to Arkansas once I got out of the hospital because whenever I was in the hospital, I had my family was done with me. They were like, "Okay, you relapsed again. We're done with you. You're either going to figure it out or you're not." So I was like, "Okay." I had nowhere to go. Couldn't walk. I was in a wheelchair. And so my cousin found somewhere for me to go live in Arkansas, like a rehab. So I went there. And yeah, I ran into that all the time. I couldn't find any doctors that knew anything about it. And when I get to Arkansas, I find out that I am pregnant from the incident of this happening to my legs. How they missed it the whole time I was in the hospital, I
Mm.
don't know. But that's the baby you hear in the background now. Yeah, so I I wasn't able to do a whole lot of rehabilitation because of my pregnancy.
Mm.
I did a total of, oh gosh, maybe about 3 weeks altogether in the 2 years that it's happened.
Yeah,
Um, so I wasn't able to get a whole lot of rehab. And at this point, I don't know if there's anything more that can be done.
true.
Um, I mean, I walk now. I'm walking down the stairs as we speak, which takes forever, but I can do it. Um, but yeah, my family didn't talk to me for a while. They just kind of continued to tell me, "Oh, well, it's all your fault. You're all on your own." Blah blah blah, blah. Which I just had to respect. So, kind of just and I've been searching for every day. I look for online for what are things I can do. Online knows nothing. Every time I type in acute compartment syndrome, it directs me to chronic compartment syndrome, which is nowhere near the same.
No,
Um, when I went to the doctor, I just went on Friday, and I was establishing care with this doctor. It was just a primary doctor, and I kept telling her it's acute compartment syndrome, and she kept saying accidental compartment syndrome. I'm like, that's not what I'm saying. I don't even think that's a thing.
no,
And so
no.
so it's been really difficult to um even just like my skin grafts. Like I know skin grafts are common in like burns and stuff, and I still cannot find like any information on, okay, is the way my skin graft healing, is it normal, or like I can't find anything on any of it.
True.
um
I totally.
so it's weird because there's I don't know if I just have my notifications turned off for it or something, but
Mm.
it doesn't seem that there's a lot of people that comment in it too often.
No.
And I did make a on accident. I was looking it up on TikTok, the acute compartment syndrome, just again seeing what I can learn from others. And this girl was showing me her scars, and I was wanting her to show my scars, not
Mm.
knowing, because I don't know how to use TikTok, not knowing that I was posting to everybody to see. And I
Ah,
get on Facebook or TikTok like 10 days later, and I have like 80,000 views, and all these people messaging me like, oh my gosh, I have the same thing.
really?
um yeah, so I've been able to talk to a couple people through there. A lot of times what ends up happening is it's like they're ashamed to tell what exactly happened to them. If it was from drugs is usually what I find out. Like if I just ask them, hey, what happened to you? They're
Mm.
real like vague about it. But then whenever I tell my story, they're able to be more open, like, okay, well, and this one guy, he was like, you're the only person I'm telling this to, and my mom doesn't even know, but mine is also from drugs. So
Wow.
I've noticed that people, and I get it, like I was in that spot before, like ashamed if I was doing drugs and all this stuff, but now it's like I'm just trying to be open and honest so I can get to the answers of what I can be doing to, go further along. So that was kind of the goal of I just moved back to Missouri about 2 months ago. In Arkansas, I had absolutely no luck with finding any doctor that knew anything.
Really?
And a lot of times what I run into is doctors thinking that I'm wanting to be put on disability, which is far from the case.
Mm.
I mean, I have to work from home. I can't move much at all. Like I just started being able to shower standing up, and it's been 2 years.
Wow.
And I've been a single mom with my daughter, and I have no help. My family still doesn't really talk to me, and so it's kind of all been on my own. The best it but I will say, of course I miss my family, but it's been one of the best things that's happened to me in my life, because it's the only thing that's like, okay, everyone has a rock bottom, but this was my rock bottom, and so and I know over time, my family will see with actions rather than words. She's done this all on her own, and she's making it happen.
Wow.
And like I purposely just moved somewhere with stairs so that I could, okay, walk up and down the stairs just to give me some sort of rehabilitation, because so I go to the doctor on Friday, and I'm telling her, well, I would like to get a referral because my insurance requires a referral to
Mm.
go back to Wash U. And it's about an hour from where I live now. And she's like, well, they're not going to do anything for you. And I asked her, I'm like, well, how do you know? You've mispronounced the name of the condition I have
Yeah.
5 times now. How are you going to tell me that
Yeah.
there's nothing that can be done when I'm wanting to go back to the doctors that originally did my surgeries?
Mm.
And I've tried to make appointments with them on my own, but of course they need a referral in order to be able to see me. So it puts me in this like position where, okay, I don't know where else to turn. I look up different rehabs that or physical therapy I can do online. But it's put me in this place where it's like I can't get any help from a medical professional, because anyone I talk to, I have to explain to them what the condition is, what has happened, and they all seem to think I just went on disability, and that is the last thing I want. I don't want to be on disability.
Sure.
um, and I do believe that if there was more, that's why I was so excited whenever you put that post in there, because I was like, oh my gosh, I know it won't help me necessarily, but for people that are now getting into the hospital and it's happening to them, if
Yeah.
they are diagnosed quicker, then maybe the extent of their injuries would not be as severe. Because I believe that if I was diagnosed an hour into it instead of 6, then I would have way less damage done to my legs.
Yeah.
And so that's why, and it's like something I've always wanted to do, but I'm like, I don't even know where I would start. So all I can tell you is It was the worst pain I have ever experienced in my life to date. I've had a baby previously, um, before this compartment syndrome happened,
Yeah.
and giving birth is like nothing compared to the pain of acute compartment syndrome. To the point when he told me he was going to amputate my legs, I remember telling him, if it takes the pain away, you can have both of my legs. It was insane. Um, and it really compares to nothing, because my legs were swelling. Like I have videos of my legs, they were swelling. um and I mean, I was screaming. I was in the ER screaming. And I mean, I remember I was being so rude, and it's something I know she never thinks about, but I was so rude to that nurse in there. But I was just in so much pain, and they weren't taking it seriously.
Uh,
She just kept telling me, "Oh, you just overdosed. That's all you did. You just overdosed."
oh,
And I'm
no.
like, I am in so much pain. I'm screaming. I couldn't talk. And it was like that type of pain that like makes you just want to puke over and over and over again. And I mean, it was terrible. And then I had a C-section with my younger daughter, the one that was a result of it. And I mean, it was nothing. I remember the doctor, he was like, "Are you okay?" And I was like, "Yeah, I don't feel anything." He's like, "Okay, well, your baby's head is like coming out. Why are you like not even flinching?" And it
Cool.
was like my my pain tolerance is like nothing can bother me. Like, and so it was definitely the most painful thing I have ever experienced. And I don't think there's much more that can top it. And if there is, I don't want to know what it is. And again, I was septic, and I was real in and out of it. But from what I do remember, is they explained it. I don't know how well they explained it. They just kind of told me you had a lot of pressure built up in your legs.
Mm.
Your muscles have died, and due to a cutoff of circulation, and we're gonna have to cut your leg off. And I did have to sign. They actually, like, once the surgeon got there, I mean, he was walking down beside me. And he's like, "We're gonna have to take at least your right leg, and we need you to sign for limb removal." And I was like, "Okay, let's do it." And then when I woke up, I was like, "This is so crazy." It's like I can see both of my legs, because they had me on so much pain medication. And they were like, "No, we were able to save your second leg, but we're going to have to do another surgery just to make sure there's no more pressure."
Mm.
Um, in my right leg, they cut out about 80% of my muscle. I can't
Wow.
remember how much of was cut out of my left leg, if any at all. I think they may have just had to release the pressure in that one. But and then another thing that this has been the longest ongoing pain is the nerve pain. That is, and it's gotten better as the time goes on. But I remember, I don't know, maybe about 3 months after it happened, I remember thinking, I can't live like this. Like, I cannot live with this pain. It was constant. It was painful. It was like, because at this point, my entire right leg, I have no feeling in it. I've kind of learned to just adapt. I definitely use my eyes a lot to walk. Um, but the nerve pain was like it, and it's not as bad as it is. It's not an everyday thing. I notice it more if I'm just like, if I just don't do anything the whole day. If I just, and I work from home, I sit on my couch all day, but I still try to, like, even if it's just doing dishes, or walking up and down the stairs 5 times just to get up and move around.
Yeah.
I notice if I do nothing the whole day is whenever I feel it the most.
Uh,
um, which is so weird, but that's just how it is. And I mean, I've tried compression, I've tried a whole lot of stuff. And the swelling is another thing that I still can't necessarily get under control. And I don't, and a lot of it is hard for me to pinpoint, because I don't know how much of it was related to when I was pregnant, and just swelling comes with pregnancy. So I don't know if that had to do with it. But I mean, I was pregnant freshly out of the hospital. So actually the entire time I was in the hospital, and they just didn't seem to pick up on it.
Oh,
which is crazy with all the medications they gave me and that I had a healthy baby.
yeah, sure. Wow.
Yeah, because I mean, at one point they were giving me like I had an IV with medication, and then I had, I don't know, they had to give me like 3 cupfuls of medication, like orally. Um, and yeah, it's definitely been a journey, but I think that it has changed my life in the best way possible, which
Wow.
is so weird. It's like I hate that it happened to my legs, but I'm also very grateful because it's the only thing that's like kept me on like a straight path. And I haven't touched a single substance since it's happened,
Oh,
and that alone is insane to me. But it was just my rock bottom. And then like my scars, they are probably, I have long legs, but they are probably, I don't know, at least a foot long and maybe, I don't know, 3 inches wide
wow. Okay.
at my skin graft. Which
Okay.
I had skin grafts on both legs, but and then my insides were able to be stitched up, but the outsides of my legs is where I have the skin grafts. Okay, so I was admitted into the hospital on September 26th.
Mm,
My left leg was, that's what I call my good leg. That one, gosh, they closed that one up pretty soon. So they
wow.
had to cut open on all 4 sides, inside and outside. On
Sure.
my left leg, the inside of my left leg was closed after the first surgery. I would say I got the wound vac off on my left leg maybe like October, first couple days of October. Um, the right leg, they were gonna do skin grafts on both sides of my right leg, which I'm so thankful that they didn't, because what a leg that would be.
Sure.
Um, it, I would say maybe 2 weeks. And what's really crazy is like I don't know if it was because they had me on so much pain medication at the time, because they were giving me morphine every 10 minutes through an IV. And like
Mm,
at the time I didn't even really realize the severity of what just happened to me. I mean, I'm on oxygen, I'm about to start dialysis, which I did not have to do. I was able to, I don't know what happened there. It was some type of miracle, but they were like, well, I don't know, you don't have to go dialysis anymore.
wow.
Um, but like I didn't understand the severity of what happened.
Mm,
Like I knew, but it like didn't really phase me, I guess. I was just like, okay, well, whatever you got to do, just do it. And
yeah.
then but now, like, because the whole time I was in the hospital, I would take videos and I would take pictures of my legs, just to be able to look back on it. Because my brother, he was in a car accident about 10 years ago. He was in a coma, didn't know if he was going to live. He has a traumatic brain injury. And
Wow.
that's what we did for him. The doctor suggested it, or the nurse, take pictures so he can see his progress when he's feeling like he hasn't made any progress.
Yeah.
And so that's what I did for myself, is I would take videos and pictures and all of these things so that I can be like, oh my gosh, wow, I mean, it's really changed.
Yeah.
Um, and I'm glad I did that, because I can look back at it now and just remember like just the fog that I was in at that time. I really cannot remember. I know they did the probe because I have a scar from it, and again, my medical records. Um, but I don't remember the pain of it. I know people say it's painful, but I don't even remember it
Sure.
at all. I just remember them telling me, this is what's happening. And I guess the main thing I remember, for them telling me what they knew it was the color of my urine, because I had gone septic
Yeah.
because of my kidneys. And that's really the main thing I remember for them being able to determine what it was.
Mm,
And another thing is like I was in so much pain, like even if I was fully coherent, I I don't know if I would have remembered it, because whenever I remember it, I remember being in the hospital, I don't know, 20 minutes, and they say, okay, we're taking you down to surgery. But that's not what happened. I laid there for 6 hours before they, and this is already after having been laid outside. And it said in my medical report, maybe it was the police report, that I was found with my hips in the air, which I'm not sure. Because they suspected foul play from how I was laying, and because it looked like I had been buried. Um, which is another, because I was with someone that I didn't know. I had met him on Facebook, did not know him. Um, and so I mean maybe he did it. And then in St. Louis, which it's known as a pretty dangerous area, which is exactly where I was. And I mean, he very well could have left me to die and I would have no idea. He either blocked me on all his social media, and I never know his real name. So it was just, there was nothing that um, I could get answers from. And I spent so much time trying to understand, how did I get in this position? But then I just realized it's not going to do anything. I may never know how I got in the position. I know the position I'm in now, and I'm not going to hold on to any resentments towards this guy. Like I was just putting too much energy into it for no reason. Like I was trying to be my own like crime scene investigator, and I was like, I don't even remember. Like I could have put myself there. I don't know how I would have buried myself, but that's what I remember. But I do remember telling the paramedics, they were like, get on the stretcher. And I was like, I told the paramedics I'm paralyzed. I can't. And at that point, I didn't know what was wrong with me. I just felt paralyzed. I knew that, I mean, my arms didn't move. I couldn't lift my head up. And that was due to me being septic. My whole body was shutting down. I mean, it's definitely affected my day to day. I I've always been a very people person. I Most of my work history is like I was a server, bartender, on my feet a lot. Um, just going out and doing things, whether it's just like walking around, a farmer's market or something of that sort, and or just going to the mall and going to the store. And it's like, um, I have a friend out here, and she'll like invite me to go shopping, and it's like I have to take pauses every once in a while because I can't stand for as long as I'd like. Um, I can't. Another issue that I have is shoes. Like it's the craziest thing, but I can't find shoes that I can wear because I mean I just finally found another pair of shoes I could wear because the last 18 months I wore one pair of Crocs because I can't wear shoes that don't have a back strap. For whatever reason it is that I can't wear shoes without something that supports the back of my foot. They just fall off. I wouldn't know if they fall off because I can't feel it, but it can be dangerous because if I step on something, I then now have an infection and I have no idea it's even there. Um, so there's that. Um, uh, it's hard to take in. I've never been one of those parents that I'm like, I'm going to put a leash on my kid, but I'm getting to the point, she's a year old now. She's running around, and it's like if we were in a parking lot, I want to be able to chase her because I physically cannot run.
Mm.
Um, Stuff like that. My balance is definitely better than it used to be. Um, but there's still times I have to catch myself. So it is a little scary walking down the steps, holding the baby, just because I don't know when my balance is going to give out. It just will. My entire foot will go out, and I don't know when that is. So I just have to go really slow. I don't, I would, my goal for myself is to be able to start driving, whether it's with my left foot or my right foot. I don't know if it'll ever be my right foot because I've had zero feeling come back to it. I'm able to get my foot to move a little bit, but I still have a little bit of issues with my range of motion.
Uh,
Um, I I've gained a ton of weight because well, first I was pregnant. And then second, I can't be active. So that's something that is not cool.
Sure.
So there's that. It's just kind of changed. It's changed everything about me, some in most ways, in a good way. Of course, I can't wear jeans anymore because my leg is twice the size as it used to be just because of the scars. So I can't get jeans over my legs. Um, just little things like that, which don't seem like a big deal until it's like, okay, well, this is my reality. I can't dress the way I used to dress, and just little things that make me feel like myself. I'm not really able to do a lot of them anymore. And it's just like very but overall, like, it's made me appreciate the smallest things
Mm.
in life. Like when I was in the hospital, I was so weak, I wasn't even able to wash my hair. I wasn't able to have my teeth brushed for, she was like 23 days. The nurses there, I was in a smaller hospital. Definitely, if you ever came to St. Louis and they said, what hospital should I go to, they would probably tell you to go, not to go to the one that I was at.
Oh, okay.
So that's the one I was at. The nurses were great. I mean, they saved my life. They took care of me, but it was just little things like brushing my teeth is like a luxury to me almost, which is just
Yeah.
crazy because it's just an everyday thing. I remember throwing my shower chair away and I was just like crying because I was like, I never thought I'd be able to shower,
Oh,
standing up again.
yeah.
So it's definitely changed my everyday life. There's and sometimes I'm like, oh, I'm being so lazy, but it's like I physically cannot, I can't do the things I used to do. And I remember when I would be in therapy, they'd be like, stop trying to run, you just had something very traumatic happen to you.
Yeah.
And I just wanted it all to be back to normal right away, and I just kind of had to say, okay, well, it's not going to happen. Yeah, for the most part, I do. So where I live, it's a little bit far from all of my friends, but
Mm.
they do all check in on me. Is there anything you need? Need to go to the store? And I've gotten so used to just sitting by myself, which has been incredible for my mental health. Is I think the best thing someone could do is just sit alone by themselves and get to know themselves before anything. And I think a lot of it is your mindset. And you just, I didn't have to choose to adapt, but I did. I actually have this guy that's on my Facebook, and he had compartment syndrome, but it was in his arm. And I remember seeing his post. I didn't know him before, really. He was just a friend on Facebook. And I kept trying to reach out to him to say, hey, I know what you're going through.
Mm.
And he was so hesitant to reply to me. And now we talk all the time because his also was from drugs. Nobody knows it was from drugs except for me. And he's still in the very beginning of it, where he's super depressed, doesn't know how he can live his life. And I just talk to him, tell him I know exactly what you're going through. And that's something that I searched for the entire time I was in the beginning of it. Just somebody that knew what
Mm.
I was going through. Um, and that, and he thanks me all the time for it. And it's like I'm just I went through it, so I might as well give to you what I wanted for myself. The person before me,
Mm.
like me, um the old me would have let it tear me apart a long time ago. But
Mhm.
I think, of course I wanted support when I was in the hospital. I had no visitors, no one visited me. The entire 45 days I was there, I had no visitors.
Yeah.
And it sucked, it was lonely, but it was really good for me to be like, okay, well, I can either sink or swim in this situation, and I want to not. I'd love to prove to everyone else that I could make it over this, but to myself, I thought I owed it to myself after all the years that I had been on and off of drugs for like 6 years
Mm.
at that point. So for me to say, I have all of this stacked against me, and then to find out I was pregnant, I owe it to myself to get on the other side of it. like when he's like, "Are you sure we can talk?" I'm like, "I promise you we can talk," you know? And
Yeah.
he wasn't into drugs. He had just happened to I think he had like tooth pain or something and got a bad pill and passed out for so many hours on his arm.
Yeah.
And so I just yeah, it's it's been quite the journey, that's for sure. I think the main thing would be like an early diagnosis of it.
Mm,
Um because whenever I made that TikTok, I've and a lot of them seem to actually be from the UK. I've talked to
mm,
maybe there's been maybe like 7 people altogether that have reached out to me from my video that I posted on TikTok.
yeah.
And I'd say maybe 4 or 5 of them actually have been in the UK. And it seems as if the US has a little bit, our healthcare is a little bit crappier, I guess, than in the UK, just from hearing what they have had to say. But I think early diagnosis could like prevent a lot of further damage, because I truly believe if I was diagnosed hours earlier, then I may be up and walking just fine.
Yeah.
So I think that would definitely be something important, and just maybe being able to find a doctor that understands,
Or
not even understands, but it at least is knowledgeable in the condition, which I know it really is asking a lot, because I have gone through doctors. I mean, I don't stop going to them because they aren't aware of it, because I realize it's not very well known. But it's like when you look up compartment syndrome, it goes straight to chronic, which is not nearly, I mean, people don't even go to the hospital for chronic. They may lay in bed for 3 days and they're up moving again.
yeah.
So I just I would like to see that there's more information done on the acute compartment syndrome, however that may look.
Mm,
Because now I'm in the part where I'm like, okay, is this normal? Am I experiencing something that's abnormal? I would have no idea, because I mean, Google, your good old trusty Google, they don't know. Um, and even just like with my skin grafts, which is so crazy to me, because my donor site, it's on my left thigh, and it's like I can't even, I get these like weird, and it's healing fine. I mean, everything I know is healing fine. I know that I'm healthy.
yeah.
All of my blood tests come back, my liver's perfect, my kidney's perfect, all of that. But it's like, okay, am I supposed to be getting these weird blisters on my skin graft every once in a while? Where my skin graft was placed will like randomly bleed. Is that norm? Like, there's just things that it's like, I would like to know, am I making the progress that I should? Or is there something more that can be done?